I've never apologized for hormone replacement therapy. Under the right circumstances, it's an extremely important tool to keep women functioning because unfortunately, hot flashes and night sweats impact almost 90% of women in the workforce. And it's one of those variables that truly keep women from going to the next level because they start to can't sleep, then they get irritable and they get moody, and then they feel like it's not worth it because they don't feel well. They're not putting up their hand to say, I want to take leadership in this company or whatever they choose to do.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Dizer, and today I'm excited to introduce Dr. Elaine Chin, MD. She's a leading wellness expert, media personality, and award-winning author. Elaine's renowned for her pioneering work in personalized medicine, integrative health, and corporate wellness, a perfect guest for our show. As the former Chief Wellness Officer at TELUS Communications, she's left a significant impact on corporate health. Dr. Chin's the founder of Bespoke Wellness Group at One Yorkville in Toronto, Canada, her newest endeavor and one she's very proud of. They offer concierge healthcare, virtual health, corporate wellness programs, and cutting-edge Medi-Beauty services. Her educational journey includes a medical degree from the Temertree Faculty of Medicine and an MBA from the Rotman School of Management, both at the University of Toronto. Please enjoy my episode with Dr. Elaine Chin. Welcome back to Personalized. I'm here with Dr. Elaine Chin. Welcome, doctor. How are you today?
I'm fine.
It's very nice to meet you. Thanks so much for coming on the show.
Well, it's my pleasure.
We've got this really cool show where we get a chance to talk to experts from all walks of life who are focused on integrative personal care. I'm so proud to be able to chat with you. I took a peek at your website, your brand new clinic. I'm so impressed with everything you're offering, everything you're doing. Tell me a little bit about your clinic, if you don't mind.
Well, we are called the Bespoke Wellness Group. We're located at 1 Yorkville Avenue in Toronto.
What a location.
We love it. And the most important part of what we do is they're here to tailor people's health and focus on personalized medicine and also regenerative medicine, which is new to our portfolio.
Incredible. Tell me about the journey that brought you to this new space, this practice, this new practice, and this way of supporting people in your region.
So this new practice came about because during COVID, the Four Seasons Hotel, which is just down the street here, literally, asked me to help them create a med spa. And that was just pre-COVID. And then the universe changed on Earth. And we tried to open and close a couple of times. And I was like, okay, this is enough. And the space wasn't quite correct. And every day I'm just walking by the building where I am now and was thinking, well, my lease is running out and I have to go somewhere or I can retire. Now, what happens along the way when you have something like COVID happening in your life and to other people, you kind of go, Jesus, I'm alive. There must be a higher purpose than to kind of exist. And I think the straw that broke the camel's back was a really good girlfriend of mine who finally got a life that she really loved to have. And she was selling her law practice and boom, she gets pancreatic cancer. And I'm like, if you're supposed to live on Earth, right, you're supposed to make an impactful difference. And I've just turned 60 and my son's no longer in the nest and he's off on his own. And that leaves me with the opportunity to say, now what, right? So this is my now what. We're here as a medical and wellness hub. We're going to teach people how to not only live longer, but healthier, and to make sure that their health is tailored to what they need so that it's theirs, it's personalized. It's their journey and we're helping them with their health journey.
Absolutely. Okay, my goodness. So often when I speak to people, it's like something significant happens either to themselves, their family member, friends, colleagues, and it inspires them to go all in on this type of approach. I noticed that your approach includes a series of things I'm very interested in, have some experience with, but I'm not expert. And so I'd love to spend some time going through some of those so I can become more expert. That's my goal with these shows. It's very selfish.
All right, let's go for it. And then we'll try to keep it a little simple so that the folks who are watching who don't have a science background will be able to understand what we're trying to say here. So
There
go
you
for it.
go. Well, we can start with MRI. People have heard of MRI
Mhm.
before. I'm 2 blocks
Right.
away from Pronuvo's original location.
Yes.
And we work with
So
them all the time. I'd love to hear your perspective on the Pronuvo MRI.
so you're in Vancouver and you're talking about Prenuvo in Vancouver. That was Clinic One. And they had a life purpose to help people use this technology from a preventative perspective. A total body MRI is what they're known for. And funny you say that. We are literally doing a MRI urban health retreat in New York City because they have a fourth generation magnet. Actually, there are three there. And the importance of the total body MRI is that you literally scan anatomically from head to toe. There are some things that you can glean from genetics because now you know your blueprint and you can understand what risk factors you have. You can do what we would call traditional diagnostics of blood, urine, saliva to better understand whether it's your metabolics or your hormones or your nutrients. But anatomically, the only way to really see yourself from the inside out is to stick your body in a total body MRI, a magnetic resonance imaging machine, and they take pictures of you. I love it because it has shown to have no increased risk of cancer, unlike a CT scan, which is truly radiation. So I'm a huge fan of this thing. Some people need to do it also for density of their brain to see if they're starting to develop dementia or Alzheimer's. And others are scanning their livers to see if they're getting fatty liver or not so great cirrhosis of the liver. So I'm a big fan. I mean, let me just give you my insights. I've had a huge family history of cancers, and I go every which direction to try to look for stuff.
Mm-hmm.
But when you're doing the scan and you're fine, what I also learned was my neck and my spinal cord bones are straight, like straight up. And that's why I'm going to use that excuse why I was never a good ballerina. I could never be really flexy. And my neck always hurts. And now I have a full excuse, as my chiropractor friend says, I'm not supposed to lift anything over 20 pounds. So when I get to an Air Canada flight, I just find the nicest human being male and say, excuse me, can you lift my bag because I have a neck problem? That's my MRI, right?
That's your MRI. Oh, I love
Yeah.
it so much. I may have been one of the first people to have one. I carried my USB around with me for a year.
Really? I
I
mean,
pop
those
it in all the time,
pictures,
check it out.
anybody that has it, I mean, that's what I should do, shouldn't I? I should really carry my USB key
There you
to
go.
show people my scan. You really do that?
I
That's
did it.
really
I did it for
weird.
a long time because I was so interested. I was like, okay, every time I get a chance, I would check it out and like look through 1,600 images in 1 hour is what they were doing at the time.
600 images in 1 hour.
1,600.
1,600. I think it's a lot more now.
It's a lot more now. That was the sandwich board they had outside. It was very cool and it drew my attention. So we've run a series of them, but it's quite impressive for finding small tumors.
Right.
And
It's
I had a chance to talk to Dr. Raj, one of the founders, about it. He's such a cool person.
he's a double PhD, double like expert in radiology, and he's something else, and he's an engineer.
Incredible.
Yeah.
So you use it as a screening tool, but also in these other areas. These other areas I haven't used it for. So tell me a little bit more about the brain imaging part. You're looking for size?
Yeah. So obviously, technology advances and the software advances, and they can now look about the density of the brain and anatomy of the brain, and ditto with the same with the liver. So I think it's really important.
Yeah, very, very, very important. I wish everyone could have access to something like this. So you're giving a presentation. Tell me a little bit about the retreat. What type of retreat is this?
I call it urban retreat in the heart of Manhattan. So we're going to be staying at the Equinox Hotel. It's one of the few hotels right now, really, in my view, that focuses on wellness, from like double panes of windows to make sure it's really quiet, full darkness, temperature control so that in the evening it drops a little bit more. The duvets, husband and wife or couples, or whether they're male, male, female, it doesn't matter, friend, friend, different duvets so that people don't steal each other's blankies. And the beds are all natural with no springs. And my favorite is their cupboard and their drawers. They have a drawer full of healthy treats and all natural boosters and things like that.
Cool.
And even their water, they're using alkaline water, which, for some people, it's a very trendy and correct thing to drink, right? Every day, right, David?
Completely. Oh,
Yeah,
that's very cool. That sounds like it'll be a great experience.
it will be. You come and visit with us in New York.
Oh, thanks for the invite.
Hmm.
The other thing I noticed that you have been utilizing in your practice is telomere assessments. And in fact, I believe you wrote a book on it.
Yes.
This is something that we use here, but I do not consider myself an expert. In fact, I need to consult with people who have more experience with me every time I do the test. I'd love to learn about your use of telomere assessments.
Yeah, I would say that it's a bit of a blunt instrument.
Mm.
But the intention here is when I wrote my book, I think it was almost 10 years ago now, I became very frustrated with people saying, so prove it to me. How is what you're telling me in terms of prevention modalities really going to make an impactful difference in how long and how healthy I stay? So let's talk about telomeres. Telomeres are the tips of your chromosomes. Think of them like the plastic tips of your shoelaces. Every individual is born with a certain length. And as you zip and unzip your DNA to take a photocopy of it so that you can make proteins and tissues in your body, a little bit of that telomere starts to shorten. So I think of it as like zipping and zipping, you start to fray the edges. And when you get to not much telomeres and it's severely short, it doesn't necessarily kill you, but I use the analogy of people driving around with bald tires in the winter. If it's
Mhm.
dry, it's not a big deal, which means that, you're steady along and you're not having an infection or you're not bombarded with some cause that can increase your risk for development of abnormal cells and develop cancer. But if you are, or you have an injury, you know that if your telomeres are shorter, the probability of getting a autoimmune issue or a cancer issue increases. So there are things that shorten your telomeres prematurely, and it goes everywhere from lifestyles. Start with cigarette smoking. If nobody realizes that now, duh. Okay. And then alcohol. Alcohol is our new cigarettes, and we have to learn how to have a different relationship with alcohol. And that's why in this space that we have a patio and we offer only mocktails on the
Nice.
patio and smoothies, healthy smoothies. Inflammation related to sugars. Again, whole fruits versus fruit juice in our smoothies. That's just an example. And sleep, the importance of sleep and lack of sleep or chronic lack of sleep shortens your telomeres. If you are noticing that you're not exercising, it turns out that later in life, exercise is more important in slowing down the degradation of your telomeres. And then we also understand that vitamin D and omega fatty acids, these are anti-inflammatory nutrients. People who have higher levels of vitamin D and omega have healthier, longer telomeres than those people who don't. And the list goes on and on. And on the opposite flip side is if you watch all the inflammatory risk factors, the obesity risk factors, the depression risk factors, if you have an ability to meditate and to have life purpose, your telomeres actually lengthen because it activates something called telomerase. Kind of makes sense because if you're trying to kill yourself, the body will help you kill you. And if you're trying to improve the quality of life of the people around you, then your telomeres will help you live a longer life. It's just that very simple.
Incredible. Well, that's a really comprehensive review. One thing I learned is that you strongly believe you can lengthen your telomeres.
It's not, I strongly believe it's scientific proof that there's only a few things: life purpose and meditating.
Life purpose and meditating.
So the monks have it right. Yeah.
Wow. Incredible. So I can freely say life purpose and meditation is going to lengthen telomeres. I just love that so much because people ask me all the time. And I just say, I don't know because I haven't seen the data.
Listen, I'm going to send you a book after this, okay?
Please, I would love to. I'm obsessed. So how do we get here? So your example was someone says, prove it to me, lifestyle. How did I get to this place? Or am I in a place where I'm at risk? Is this what drives you to run this test?
Oh, absolutely.
When do you decide to run it?
Well, I run it because people want to know. And if the people have short telomeres, they have to like watch it because, literally they're at the end of their rope. So they really need to watch what they're doing. I think that's really important.
Well, I would agree with that. Like, I'm the type of person who just is obsessed with objective data and I find it quite motivating. And so people are reaching out to me in particular because they know that about me and they want to have something that says, okay, you give me this plan. This is one thing that I can track. So I'm going to start using that more. You really inspired me to do that. What else are you thinking about in the longevity space in terms of objective assessment?
I'm going to answer that by saying that there's not just one thing. I think of
Right.
your life like a symphony. You go to an orchestra, and if you take one thing away, like the percussion instruments, this music's not the same. Or if you take the whole violin section out, it's not the same. Your body needs to work on a number of things. So it's about hormones, about nutrients, it's about your inflammatory markers. And we have to even look at your brain chemicals to make sure everything is in balance. Otherwise, why would you expect your body to be in balance? And how would you expect that to help people live healthily? So I don't believe that you can just work on one thing. And that's what makes it hard. And that's why we open this clinic here, because we have to keep people on track. We have to give people access to not only a medical facilitator to coach, but a naturopathic doctor. Sometimes you need a psychologist. Sometimes you need a nutritionist. Sometimes you need a fitness trainer. And so we want to make sure that we give people access to those types of folks in a very preventive medicine way that's very personalized.
Absolutely. Well, it sounds incredibly holistic. You mentioned one thing there that I like to start with, if we could, which was nutrient status. And, assessing for nutrient status, I think, is absolutely essential, literally for everyone, especially when we're thinking about longevity and health span. But do you ever use DNA assessments to give you some insight into whether or not someone should have even higher levels than what the typical reference ranges would be?
Yeah, so I would say yes. In a short answer, yeah, I do use genetics for nutrigenomics. I'm proud to say I was one of the first doctors in North America to offer consumer genetics. Enough for me to get a
Wow.
front page in the Globe and Mail in the year 1999. I think I had my another one, but when we're turning along the next phase of the world, I think it's important because each person has different ability to absorb their nutrients, or make their nutrients. So vitamin D, I will tell you that because I had access to these genetics tests early on in my career, you could measure the vitamin D levels and find that they're low. And so you can pop more vitamin D, and it's not going to be 1,000, it's not going to be 2,000, it'll be 4,000 or to 8,000. And you measure it to be correct. But more importantly is that when I caught this, every single male and female had osteopenia, osteoporosis already around 60 because they had a lifetime deficiency of vitamin D. So that's just a good, solid example. Another one would be the omega fatty acids, which is another common genetic marker that we need to look at nowadays. And this is a marker that, in my view, is your natural source of, I call it natural ibuprofen. And it's an anti-inflammatory. Who wants to walk around being in aches and being in pain? And that erases a lot of people's problems with arthritic-like symptoms. And equally important, people with migraines. David, I'm sure as an ND, you've used a lot of it. And some people need to take 6 capsules or 8 capsules, and they're like, oh my God, I'm not taking it. But look, Your blood levels are not going up. Your genetics is showing that you are a poor absorber. So A, you need to take more, and B, you can't take the cheap stuff
Hmm.
because it's not bioavailable. So I don't know about you, but I love using Designs for Health because they have a lipase in it, and it's also a triglyceride base. So then you don't repeat, and feeling like you're having morning sickness taking fish oil, so to speak. So I really like that product. And having lipase right in that product helps you digest it faster and absorb it faster. So there are techniques, right, beyond genetics, beyond measuring blood work, but also getting the right nutrients source and the type of brand that we use.
Completely. People are approaching me almost every single day now about using their actual genetics to program the nutrition plans, because people know this about me. I make nutrition plans. It's a big part of my life every single day based on people's metabolism and trying to support them to optimal body composition. But now the thing is, okay, can we form this around my genetics? So I took a peek back at mine because my wife and I did this like a long time ago. I can't believe it. I'm a poor methylator. I'm shocked. I'm terrible at storing vitamin D. I'm shocked. And so now over the last few weeks, I've actually been considering that. This is N of 1, of course. And oh my goodness, folate makes me feel better. Can't believe it.
Wow.
I'm shocked. Do you ever consider methylation status? Is that a part of your practice at all?
Yes. So the good news is I actually have found another lab recently. It's a custom panel that Designs for Health is about to launch. Maybe we'll talk about it right here. It's called Spotlight on Nutrition. And they've put a custom panel together that focuses on a lot of this stuff. So it's really important to be able to capture that, not only for skin health, but other things as well, right?
Oh, completely. We take a peek at as many as we can. Like there's two MTHFR genes I'm interested in, COMT, MTR, a few different ones. Lots of labs do those, but I think it's going to be quite powerful for people to know this status and whether or not, like to your point about omega-3s and vitamin D, that makes a huge difference for people.
Mm-hmm. Mm-hmm. Sometimes you can take Bs, you can just keep loading and it's enough, right? You can actually measure that. But I'm sure you get the same question from people. So how much vitamin D should you take? How much should I take omega? Should I take this? I said, I don't know, measure it. And
Mm.
then they'll go, then you take too many pills. And I said, well, we can make a custom pill for you. I don't know, Dave, like I think you and I both use Vitamin Lab. And it allows us to customize people's supplement protocol so that you're not taking 16 pills of different sorts. You're taking one capsule, and each of the capsules have the similar type of ingredients in it. So all you do is just grab maybe a small handful, whatever it might be, the dose, 4 to 6 capsules a day, has all the things you need. There's no magic pill, by the way, everybody. There's a magic few pills.
Magic females love it. Yeah, it's nice, especially for those people with chronic disease already. And, they're thinking like, oh, I hate prescribing more than 3 things. Like it bugs me so much. To be able to put a series of items into one package for a person can be very helpful. I'm a huge fan. And I just love the approach that you're taking to longevity. I know you've got expertise in metabolism and metabolic wellness. And I'd love to hear a little bit about your approach and the type of person who comes to see you for this type of support.
60% of people in this population now are overweight. Another 40% of that within that group is obese. And diabetes is on the rise, and Ozempic and those kinds of GLP drugs seems to be like the next magic solution. Okay, I get that. That's a lifestyle thing that you got yourself to that level. But there's a whole bunch of other people who don't know they're getting there. And I don't think they're rocket science numbers. And it took a long, long time for my colleagues to start even using A1C in their practice when it was available when I first came out to practice. And we're going to say 1988, that's a little while ago. And A1C and blood sugars, you might think that are important, but I will say A1C, might as well just do that, forget the blood sugar thing. And the other thing I usually do is I remind people when you measure triglycerides, they're light chain fats. I call them the fat in your blood, it floats to the top. And if you have it high, you literally can see it float to the top after you do blood tests and spin it. And the next place is insulin. Most doctors will never order insulin because they feel that that's the only time you do that is if somebody has a risk of pancreatic cancer. So I would say to people that if you are concerned about your diabetes, you should measure your fasting insulin because that's the hormone that breaks down your sugars to store it fast to prevent you from being diabetic. And so if it's higher than 50, I would say to you, you are on your way to being pre-diabetic. Would that be a fair statement? And people don't measure it. I just think people should.
It would be a fair statement. I got the fortunate capacity to work on West Broadway in Vancouver, which I think is like the healthiest group of physicians that I've met. They test insulin all the time around here now. The last couple of years, it's been really cool to see tons of fasting insulin. But yeah, I'd like it to be below 50. My goodness, our reference range here in British Columbia is 20 to 180 or 200. It's a
I
huge
know, but
reference range.
if one of my son's classmates' brother, I tell you, he was 17, football player in his class because he's big. He looked like to me like a freaking sumo wrestler. So I asked his mother, I said, I need you to send your son to me because I'm curious to see what his insulin is. Because my son was then 6 or 7. He's like, I'll call Bobby. Bobby eats 3 pizzas a day. It's so cool. He can stuff 3 pieces, I said he stuffs 3 pizzas a day, and it's huge. Turns out his insulin was over 500.
Mm,
And I showed it to his mother, and I was like, he's going to die before you. And that brings up the whole idea of child obesity, right?
completely, it does.
Mm-hmm.
Yeah, I hear you. We use the HOMA IR. I teach a lab diagnostics class, and I was excited to practice with the insulin resistance score the other day. So I was saying like fasting glucose of 5.2 with an insulin at the top of the normal range. It was significant insulin resistance. And so this is like, okay, this person's getting diabetes within 10 years because the pancreas can't hold up long enough.
Mm-hmm.
And so I think it's quite a noble cause for you to be doing this, especially with your conventional background. Tell me about your approaches, obviously nutrition, exercise, anything special about the way that you approach an elevated level of insulin?
Well, I make it really simple for them. You either eat your carbs or drink your carbs, and you can't do both, and no tropical fruit. And also very simple is no packaged foods.
I'd love to hear about if you have any special recommendations, how you create a plan for someone who's got an elevated insulin level.
Well, everybody's insulin level that's elevated is unique, right? So let's just do 3 buckets. The first bucket is the diet, and I think everybody understands it, but the low-hanging fruit is the new smoking is now drinking alcohol, 2, 3 glasses of wine a night, expensive wine cellars, and going out. It's like a normal routine, and I just cringe when I watch that happening. The second one is lots of carbs, right? Pastas, breads, rices, low-hanging fruit. Third one is fruit itself. Especially in the summer, it's really difficult to tell people to not eat more than 3 or 4 pieces of fruit. They do, right? And that's too much. And then we know that exercise burns your carbs so that you don't have a need to store using insulin. And I want to talk about sleep because we know for a fact that people on night shifts doing shift work have higher insulins because when your cortisol, which is your hormone that we would say helps you fight or flight, is low because you're exhausted. I say to people, your body will make lots more insulin because it's like, go find food. I mean, I'm just as guilty when we were doing night shift and you're in the emergency department. The only way to stay awake is to drink coffee and to eat. And there's never been a time where I noticed sort of like chicken wings around midnight, but you would never get up at 3 a.m. It's like, I am craving a big turkey drum, right? Like it's just not happening. Drumstick, it's not going to happen. And so you end up looking for carbohydrates. And that's the reason why the insulin goes up because it makes you crave sugars. And if you don't get enough sleep, your insulin will be high, your cortisol will be low, and it just keeps driving that desire. We have to get people to understand that lack of sleep causes obesity, period.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Gosh, I agree with that. My goodness. I've been thinking a lot about these objective assessments of sleep quality and quantity using watches and other devices, for example, thinking about deep sleep and even trying different things myself to see what kind of impact I could have on, you can tell I'm an experimenter. Recently, good success with ashwagandha for deep sleep, but usually my deep sleep protocol is really simple. Heat before bed, a nice cool bed, quiet, dark. Anything you're doing, since sleep is a key focus here, anything you're doing you can share that we could maybe implement in our plans?
Mm-hmm. How about this? Stop using your devices 1 hour before you go to bed.
They're so fun though.
Don't bring them to bed. Don't have a TV in your bedroom. All because the backlit light actually wakes up your body and prevents you from having sleep. So everybody who's listening to this should go into their iPhones and make sure they have what they call a night screen on, and it turns on at a certain time. And I also have a reminder on my device to say getting ready for bed, and I just plug it into another room and have a boring alarm clock in my house, in my bedroom.
Tell me about your routine before bed, because this freaks people out, Elaine. The idea of going into a quiet space without distraction? Come on. It's 2024. What are you doing before bed? What's your routine?
So my routine is my cell phone tells me that I need to get ready for bed 1 hour before I do. Then I put that phone away and I really try to turn off my laptop. And I go and do something that's very boring, which is to watch the news. And most people don't want to watch that these days, or something that's non-stimulatory. So I would not necessarily watch something that makes me freak out or get excited. I never have coffee or any caffeine in the evenings, nor chocolate, nor sugars. And really, nobody should be having alcohol in the evenings if they want to have good sleep. And then lately, I've had to stretch, David. I'm getting old. My body hurts in the middle of the night. So I stretch before I go to bed with some soft music, and I stretch in the darkness. And then let's talk about darkness. Darkness is also important. There's people that don't have these proper blinds, and especially in the summer. And then you got to cool down your room. There's usually these honeywells that give you different settings. You need to, I think they say 69 degrees, but I think it's too cold for me. So I like it at 71. And then have like your comforters that are lighter, but still have one on. And to stay cool and make sure you're not having hot flashes and night sweats, right? So that's estrogen, progesterone goes with my protocol.
There you go.
So to be able to go to sleep.
Absolutely. Well, that's a really nice, holistic, and comprehensive approach there. You know, I've seen 7,000 people in 9 years, and I would say a significant portion of those people are still not doing all of those things. And that's unfortunate. And I feel like I'm not sure why. I have a sense that it's this fear of being alone, you know, the risk of being within in your own thoughts. It's a stressful world out there. Most people that I speak to can't watch news before bed because it warps them out. You've got a real cool demeanor, so you're okay. What do you say to those people?
Well, I think people don't get a sleep routine going because, first of all, they don't understand the importance of sleep. So if I say to you, It's really important to eat. And everybody makes the meal, right? But it's really important to sleep well. And I think people know that now, fundamentally. It's the discipline of making sure you come first. How about that?
Definitely.
These devices like the rings, the bands that look at how much sleep you get and the quality of sleep you get, I think it's positive feedback to people to realize that they actually don't get the 7 or 8 hours that they really do need, and more importantly, to have a full cycle of REM and non-REM sleep.
Mm-hmm. Mm-hmm.
And if the listeners don't know about it, Google it. You need to have light sleep, deep sleep, and everything in between.
Absolutely. I'm really passionate about it now. My goodness. Like just seeing that and now I've had to reduce the targets because I was never able to help people get to 1.5 hours of REM and deep. It's always now just 1 hour because the 1.5 hours is too tough. But I think you're right about the darkness. It makes a big difference in having those blackout blinds. So we got here because we were talking about nutrient status and longevity. And we ended up on sleep. And I think that's quite a powerful journey for most people because so many people are looking to take the next supplement.
There are some. There's some that help. If you do a neurotransmitter, you find that people are low on your serotonin and low on their GABA, then you need to give them 5-HTP to support, right, serotonin, and you need to give them GABA to chill them out. So I'm cool with testing those things. I don't know how many people know that you can actually measure your brain chemicals.
I think it's just you and I. I think you and I are the only ones.
Well, shh, don't tell everybody. It's a secret. Don't
So
don't
I
listen to us.
absolutely love neurotransmitter testing. I think it's cool. I think it tells us a ton about the balance between fight or flight versus rest and digest. Tell me a little bit about your use of this assessment.
I use it all the time. I use it for the fact that I want to know my clients' risk of their mental state. Are they more calm or are they more agitated? Are they more obsessive or are they more driven? And I think I'm going to give you an insight that if I could, I would set up a whole board of directors based on neurotransmitters. Half the group have high serotonin, which means that they're happy and nothing can go wrong. By the way, my serotonin is pretty high. So I can take lots of debt on. It doesn't bother me. People go, oh my God, you're doing this at 60. Why not? I'll be fine. And then there's the other group that will have the same exact parameters as me, and they'll go, that's too risky. So that's really your serotonin. So if half the group that takes care of your money is serotonin high and the other half that's serotonin low, and they can agree on how to take care of your money, that's the group that you need to have. And same with GABA. GABA is I guess it's our calming happiness hormone in some ways. I've helped so many people with panic attacks with it.
And so would you say you run this test when someone has significant anxiety, significant depression? What gets you into the neurotransmitter test initially?
Yeah, I think it's for everybody. I just need to know where my clients are at because everybody can hide their anxiety or their depression-like symptoms. And sometimes I kind of look at it because when somebody's on a low normal end of their serotonin, which is their happy hormone, they're more prone to depression than somebody who is pretty high on that level. And so if I know that there's something happening, such as all of a sudden they've lost their job, I'm going to keep a little bit closer eye on them because I think they'll be at risk for getting, quote unquote, into the mental deep end, right? And people with anxiety issues and low on GABA, they can't sleep and they're nervous wreck. And so I've done it so many times where I make sure that my executives who, before their big annual board meeting, I made them do their blood work again and this one, in this case, the urine test. Make sure that GABA is in good sync before they head into that annual general meeting quarter. So it has tools. We have tools. They have purpose and they're useful.
Definitely. I like looking at the dopamine on that test as well. I think that can be incredibly helpful, supporting people's dopamine levels because it can be completely off the map sometimes.
And so the only sad story I have about that one is I one time did that. And it was a young lady who ended up with a very extremely high dopamine. And we already knew it. She was an alcoholic. And it was just so high. Unfortunately, she's not on this earth with us anymore.
Oh, darn.
But that's one of those extreme measurements to know if people have high dopa, right? They need stimulatory, addictive things to keep their dopamine going.
Definitely. Sometimes it just takes, being able to see that number to make a lifestyle change. I love speaking with you because of your use of objective testing. So we went through nutrition, we went through neurotransmitter assessments. Any other specific functional assessments that really drive your practice and your treatment protocols?
Hormones, my dear.
Tell me about them. What type of testing do you like to do for hormones?
Well, besides insulin, which is a hormone, there's cortisol, which is your fight or flight. We kind of alluded to it. I do believe for some people who are in their 50s, I've never apologized for hormone replacement therapy. Under the right circumstances, it's an extremely important tool to keep women functioning because unfortunately, hot flashes and night sweats impact almost 90% of women in the workforce. And it's one of those variables that truly keep women from going to the next level because they start to can't sleep, then they get irritable and they get moody, and then they feel like it's not worth it. And then because they don't feel well, they're not putting up their hand to say, I want to take leadership in this company or whatever they choose to do. Men will find that their libido drops, their muscle mass stops, their energy stops. And so they also can look at testosterone beyond just exercising to help with their testosterone levels. And women need to look at their estrogens to help reduce those hot flashes and night sweats, but also those risk factors around osteoporosis, which is thinning of your bone. And in both variables, I think dementia, there's some role around hormones in alleviating different types of dementia. So I think hormones are still another very important aspect of quality of life that we need to look at to use.
Definitely. I love that approach. Tell me a little bit about your use of bioidentical or your use of hormone therapy. What type of hormones do you typically use? Is there a pattern to your prescribing?
My pattern to prescribing is measure the levels.
Measure the levels.
Yeah, this is in love with numbers don't lie, right? Way back when there was a whole conversation about whether you should be on bioidentical hormones or not. I don't think anybody prescribes oral Premarin would be like, oh my God, it's equine estrogen. And even pills now, they're bioidentical estrogens, estradiols, and progesterone is prometrium. So I think that has gone off the table. Some people like to use the creams. Over the years, when I've been using creams from compounding pharmacies, the strength weans and it varies really from batch to batch, no matter how you try to say that you get a fresh batch. So, and it's not very convenient. So now we're back to doing either hormone patches or taking tablets. And for men, for whatever reason, the pumps for topical and the oral testosterone is gone. So the only thing left is injections. But that's not my ideal, but that's what's going on right now in the men's world.
That's what's available.
Yeah, that's what's available. So that's really my hormone story.
Yeah. Testosterone's out of my scope, unfortunately. It's such a significant issue for people. And, it's not generally not enough to say, let's just exercise. For one, people can't sleep well, bringing us back to that, which I think significantly disrupts your testosterone. Anything else you can comment on that might be potential causation for the rampant low T that we're experiencing in North America?
Lazy. I call lazy, the sense of lazy getting on up with sitting culture now.
The sitting is so deadly. My goodness.
And I call it lazy because I sit here too. And my joints hurt more now than it ever has because we're sitting. I think it's obesity, as you know, in men makes more estrogen. So it counteracts this testosterone level. So obesity is another variable.
I would agree with that.
Yeah.
We combine those two things and it becomes a significant issue. And then, people feel so much better. In my experience, they come to me obviously for nutrition support, so much better when they normalize their testosterone levels. I feel like it's such an important key to then having the gumption to follow a nutrition and exercise plan. Sometimes we have to actually treat the hormone before we can get the lifestyle in order. You find that too?
You have to do it all in one shot. Like go back to the orchestra. You can't really pick and choose. That's why our clients stay with us all year, and we have follow-up plans throughout the year. Otherwise, once you do a consult and then let them go off into the sunset, it's just not the right protocol. So we don't try that. I have that luxury right now in my life, just like if you don't want to stay with me all year to work on it, then you're not my type of client because it takes more than just a one shot. Thank you for the, recommendation. Off they go with the book. You got to be testing, retesting, fine tuning, retooling to make sure that at any age, at any lifestyle, things that turn around the corner and whack you in the head, so to speak, those things need to be adjusted in your health action plan.
Absolutely. Now, I know you've got this other aspect to your practice that I am not familiar with at all, and I'd love to learn more about, and that's stem cell gathering, the use of stem cells.
Yeah, stem cell derived therapy. So I've been very fortunate in my career that I've had the experience and exposure to a number of new technologies. First of all, during medical school was IVF and test tube babies, like the idea that you can freeze follicles, freeze sperm, and then defrost them and then make them fertilize in a petri dish, put them back. And it's just really an insane thought. But that's where I got the hormone replacement, the whole idea of playing with hormones, because you need to do that in order to cycle people properly to be able to receive the test tube baby, so to speak. And then the MRI came along when I was training at Toronto General as one of the first MRI machines. Wow, that was pretty cool. And then not too far into my practice, it was refractive surgery and laser refractive surgery. That was another bubble, followed by genetics, consumer genetics, because I'm sure it's been available. And today, for the first time in my career, I can honestly say that stem cell derived treatments has arrived.
Mm.
And it's very available because you can extract it from your hair follicle, the stem cells. Historically, we've used stem cells from bone marrow to help people with blood disorders, more so blood cancers. And some people have been taking stem cells from fatty tissue, so it's like biopsies that are literally of there. But now you can just pull 50 hairs. These little follicles are stem cells. Now, what are stem cells? Stem cells means that they're like a type of tissue that can go into making other tissue lines. So today, my stem cells are cryopreserved at the bottom of the Toronto General Hospital in a big vat. It was 5 years ago.
Okay.
What's fascinating is I will be forever able to use a 55-year-old stem cell. That's never going to change because I cryopreserved it. So when it comes to stem cell harvesting now, the younger the better. Now is the time, not tomorrow. Now, today is the best time because tomorrow the stem cell is going to be older. The second takeaway is we are now able to take that stem cell and grow them into skin and hair lines. And my serum for microneedling it back to my face to make it rejuvenating. Now, what the heck does that mean? It basically means I'm going to have stronger, healthier tissue because the tissue line that is skin and hair has been made in a lab, and the growth factors from it, that's why it's called stem cell derived treatments, are then freeze dried, but then reconstituted with some matrix, which includes hyaluronic acid, and microneedled back into my face so that I can generate healthy tissue to make my skin stronger, healthier, and hopefully even younger because I'm using 55-year-old growth factors and not 60-year-old growth factors. And both to men and women, the studies are showing that if you microneedle these nutrients because they're stronger than PRP, platelet-rich plasma treatments that some people do on their face, which is called Dracula facial, and for the hair, some people have been doing it. It helps wake up those sleepy follicles and starts to make them grow and grow stronger and healthier. So you have a fuller, shinier body of hair. That's pretty cool. Down the road, near down the road is PRP for injury. You can now use stem cell derived treatments for injecting back into injuries of tissues. And I think soon down the road is to cure disease. So there's pre-insulin making cells that are now under study at Mount Sinai Hospital. I do believe in my lifetime we're going to be able to see that we're going to quote unquote make our own insulin. So the idea of a biological lab or a biological pharmaceutical company is probably coming around the corner.
Wow, that's so exciting. And you're right there as a leader in this space. That's very cool.
Yeah, so you need to come over and pull a couple of your hair follicles.
I only have a few left. You'll have to take my last 50.
Oh, you can look at these ones, and we can just do these ones.
Those ones would be fine.
Yeah.
Oh, that's incredible. Well, I'll be tracking your career and following along to see if I can learn more about this, and maybe I'll visit you one day.
Well, October 24th, we're having a hair harvesting party. We're calling it a pre-Halloween party.
Yes. Good plan. Oh,
Yeah.
That'll be great. That'll be a hit.
It should be. Come by.
Tell us, I want us to leave. We always like to leave with something interesting about you. So tell us a little bit about you, something that maybe a lot of people don't know. What can you share with our listeners?
Oh, complicated. So I would say to you that people ask if I'm as bubbly as I am in private, and I'll tell you that it just depends. I actually like being on my own. I'm an extrovert, but when I want to chill, I actually love to be in nature, and I don't want to talk to anybody.
Yes.
I'm happy in a mountain, so I probably should be in British Columbia, right?
You should.
Yeah, but I also love the big noise, so I'm kind of schizo. How about that?
There you go. Okay.
Yeah, I just go back and forth.
You go back and forth. Well, it's been an absolute pleasure to meet you, Dr. Chin. I'd love to know, where can people connect with you further? Where can we find more about you?
Well, the World Wide Web can find me at bespokewellness.group. So come on in there. And also my Instagram handle is the Tiger Doctor. I got that famous name because people wanted to know if I was a tiger mom. I said, well, that's not your business. You asked for my son, but I'm your Tiger Doctor, so get with it.
The perfect Instagram handle. I love it. Well, thanks so much for joining us on Personalized. It's really grateful to have a chance to speak with you.
Thank you, David. It was a pleasure.
Hopefully we'll talk again soon.
Come visit Toronto soon.
Yeah, we will. Talk soon. See you.
Bye-bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.